cool stuff. So this first slide, this is, I guess, different immune parameters that we measured. And essentially what we did is we drew some blood from someone. We had them do an elliptical exercise movement pattern. And specifically, we used a Cybex ARC trainer. It was a model 772AT. The reason why we use that is they could be moving arms and legs at the same time. And in previous data, we found that we got better responses when we had more limbs moving. So rather than just moving the upper body or the lower body, if we had movement in both the upper body and the lower body, we got a better response. And what I mean by response is we got a better increase in cytotoxic T lymphocytes. And so if you take a look at this slide, you'll see that when the individual was exercising, there's like a red column that's pre, so that's right before they started exercising. Then there's a brown column that's after. That would be immediately afterwards we drew their blood. And then we drew their blood again 30 minutes later, that's the light green column. And then the blue column would be 60 minutes after exercise. And what you're seeing is the counts of the cytotoxic T lymphocytes. So on the left side of the slide, you're seeing what happens from regular exercise without breathing in added oxygen. Then on the right side of the slide, what you see now is, okay, what happens if someone does the same exercise protocol, but this time they're breathing in 86% oxygen. So this is more oxygen than would be in room air. And the difference now is you look at how much more the cytotoxic T lymphocytes increase. So for that day, they went from 53 to 208, but across from the prior treatment, it went from 142 to 208. Now the thing to keep in mind is this is the number of cells per microliter, and there's roughly 27,000 microliters in the human body. So think of those differences multiplied by 27,000 times. And now what you're seeing is like, wow, this is a pretty significant increase. And by the way, the main point here is that breathing in a higher concentration of oxygen increased the cytotoxic T lymphocytes. Why does that matter? Those are the preferred cells that fight and kill cancer cells. So this was, think of this as initial data in someone with no evidence of cancer.